Hi everyone, today we're discussing an untapped area of nursing. If you're a nurse who's tired of bedside, or maybe just wanting to look into different career opportunities, stay with us. I don't know about you, but for me, 12-hour shifts are physically demanding and drain me emotionally. These traditional nursing roles have pushed many of us to reevaluate what we truly want from our careers. The good news? Nursing is super versatile. And there's a growing field that needs your clinical skills, critical thinking, and patient advocacy. Clinical research nursing. So what is a clinical research nurse? Licensed nurses are an essential part of the clinical research field. They help support participants, aka these would be your new patients, who are involved in clinical trials. Clinical research nurses monitor the safety of participants, track their progress or any new symptoms, manage study protocols, collect trial data, and often serve as the bridge between participants and the research teams. In short, you're still using your nursing brain, but in a whole new way. Why are nurses so successful in clinical research? While your bedside experience will give you a huge advantage in the clinical research setting, you're already skilled in patient care, familiar with medication safety, an expert in documentation, and interdisciplinary communication. All of these things translate directly into the role of a clinical research nurse. Plus, your empathy and real-world experience helps humanize the research process, as many participants may be nervous or need some support throughout the trial. If you leave your workplace feeling drained, you crave more regular hours and a better work-life balance, you're passionate about science, innovation, or public health, you enjoy detail-oriented tasks and protocol-driven work, you want to make a broader impact on healthcare, and you want a role that promotes growth both professionally and financially, it might be time to look into clinical research nursing. There are many different settings that clinical trials take place. Clinical trials or studies may take place in a major hospital, academic center, a private clinic, or a pharma company. But regardless of the setting, a typical day may involve coordinating and conducting study visits, educating participants about the trial and informed consent, monitoring for adverse events or changing symptoms, collecting and entering study data, and communicating with sponsors or regulatory bodies. And unlike bedside, you're typically working on Monday to Friday, clocking out at 4 or 5 p.m. But those aren't the only pros compared to bedside nursing. Besides having a more regular schedule with no more 12-hour shifts, holidays, weekends, or working nights, no more emergent patients or surprise visits at the end of your shifts. All visits are scheduled, so you should know who is walking in the doors and at what time. It's less physical demand and a good balance between desk work and being on your feet. This role provides more autonomy and independence. You'll often be the central point of communication in a study, and it's extremely rewarding knowing that you're contributing to medical advancements and future treatments. The bond you build with participants can be very rewarding, as it is less rushed than bedside, and you typically tend to get to know your participants a little bit better as the trials go on longer than a typical bedside stay. But how do you get started? Breaking into clinical research can feel really intimidating, but it's totally doable, especially for nurses. Some key things to do include brushing up on good clinical practice guidelines, take an introductory course into clinical research, update your resume to highlight transferable skills, network on LinkedIn or through professional organizations, or consider applying for an entry-level role like clinical research coordinator or clinical trial assistant to work your way up. Just a reminder that your nursing career can evolve. You're not ever stuck, and clinical research might just be the meaningful, manageable path you've been looking for. We do have a free guidebook on clinical research careers. I'll leave the link in the bio in case you want to learn more. It's a great resource for nurses who want to break into research. Until next time, we're wishing you the best on your journey.